Most people believe one thing about retirement. Once I turn 65, healthcare is handled. But that belief can cost you thousands, even hundreds of thousands of dollars, because Medicare doesn't cover everything. And the parts it doesn't cover are often the most expensive. The big misunderstanding. Medicare does not equal full coverage. You see, Medicare is helpful, but it was never designed to cover 100% of your healthcare costs. In fact, it leaves gaps, and those gaps are where your money goes. Let's break this down simply. What Medicare does cover. Covered Medicare generally helps with hospital stays, doctor visits, and some preventative care. That's the foundation. But here's where things start to get expensive. What Medicare doesn't cover. This is the biggest one. Long-term care. Medicare does not cover extended stays in nursing homes, assisted living, long-term in-home care, and these can easily cost 80,000 US dollars per year. What Medicare doesn't cover. Dental, vision, hearing, routine care like dentures, eye exams and glasses, maybe some hearing aids, mostly not covered. Yet these are things almost everyone needs as they age. There's also prescription, costs out of pocket. You have some prescription costs out of pocket that they won't cover. Even with drug plans, you can still face copays, some coverage gaps, some high cost medications, overseas coverage. If you're traveling outside the US, Medicare typically provides little or no coverage. Let's go to the real costs of these gaps. Let's look at the diagram, the leaking faucet. It just continues to leak, 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 leak. Individually, these may seem manageable, but over time, they hurt. A dental procedure here, hearing aids there, a few years of long-term care, and suddenly you're paying tens or hundreds of thousands of dollars out of pocket. Why this catches people too late? Most retirees don't realize the gaps exist. until they get the bill, because no one really explains this clearly. And by the time you're reacting, it's already expensive. How to protect yourself. You don't need to panic, but you do need a plan. Here are some smarter ways to prepare. Look into supplemental coverage like Medicare, Advantage plans. You budget for some healthcare costs that are not covered for healthcare. And you can also utilize an HSA a savings account. It's a health savings account. If you're still working, you can also utilize that. Because the goal is simple. Avoid surprises. Let's talk about what's next here. Medicare. Advantage. Now here's where things get a little bit more confusing, because once you realize Medicare doesn't cover everything, you're faced with a decision. Medicare supplement or Medicare Advantage. And choosing the wrong one can cost you thousands over time. In the next video, we'll break this down clearly. Which one is actually better? If you want to avoid costly mistakes in retirement, subscribe to WisePath. Because when it comes to retirement, what you don't know is usually what costs you the most. If you like, please like, share, subscribe. Thank you very much.